Hello friends, welcome to Medicine of 101. We're continuing with the, that is like the cytochrome B5 reductase enzymes and the function there, basically the methemoglobin and their functions. Okay, now we'll just talk, what did I say last time, that if there is the deficiency of the cytochrome B5 reductase, the enzyme, then you can have what? I said that whenever this enzyme will not work here, then it's not possible to get converted the Ap3 plus into Ap2 plus. As a result, what the less amount of the oxygen that will get combined with the ferrous. Okay, so ultimately the less amount of the oxygen will be delivered to the cells, so we'll have the less amount of energy. So as a result, we can have many problems from there. Okay. So now we'll talk about it. First, suppose if there is deficiency of the cytochrome B5 reductase, then what can we do here? There is medications, or you can say that is, first suppose if it is Ap3 plus, then we can make the Ap3 plus into Ap2 plus. What was our problem? Because what, in the previous case, what was there, the Ap2 plus was getting oxidized and it was getting converted into Ap3 plus, and it was the major problem there. Now if you want to solve the problem, then what can you do? We have to change the Ap3 plus into Ap2 plus. That means we have to reduce it. Okay, so we have to use some reducing agent by which we can just convert the Ap3 plus into Ap2 plus. Now we are having intravenous injection of, you can have the intravenous injection of methylene blue. Intravenous injection of methylene blue, by which we can just convert the Ap3 plus into Ap2 plus. Okay guys. Now, and it's, of course, it should be the reducing agent, otherwise you cannot have it, right? It should be the reducing agent here, is, of course. Okay, so we talked about the first, the hypoxia, then we talked about the anemic hypoxia, and we also talked about the the methemoglobin. There is like these things with the regarding the enzyme cytochrome B5, and of course with the Ap2 plus and Ap3 plus here as well. Now we'll talk about one more, the hypoxia. There is the first, suppose, what did I say? First, if there is the problem with the delivery of the oxygen within the lungs, there is hypoxia, partial pressure. And whenever there is a problem with the hemoglobin and oxygen things, so the combining of the hemoglobin with oxygen, that is called anemic hypoxia. We already discussed it. Then whenever, what did I say? Whenever this oxygen, whenever what, the hemoglobin will flow. If there is any problem in the flow of the oxygen hemoglobin together through the blood streams, the vessels, then we can have this type of the hypoxia. That is called the hypoxia due to reduction, the reduction in blood flow. If there is like reduction or reduced blood flow, then we can have the hypoxia due to reduction in blood flow. So what can you say in the or another term for it, that's called stagnant hypoxia. You can say stagnant hypoxia. So what is stagnant hypoxia? The stagnant hypoxia will take place just for the reduction due to reduced amount of blood flow. Reduced blood flow. Reduced blood flow. And of course, if there is like reduced blood flow, so less amount of oxygen will be delivered to the cells. As a result, same thing, that the ultimate class, the less amount of the ATP, there will be no oxidative phosphorylations. Now the stagnant hypoxia, it may be two types. Okay, stagnant hypoxia. Stagnant hypoxia may be two types. One of the type, that is ischemia. You can say ischemia. Another type is like this, congestion. Now the ischemia, it is like the level of artery. We can see the ischemia in case of the level of artery. We can see it. Okay, then we can see what, the venous obstruction. If we see any venous obstructive particles, Then the hypoxia, that will be called as the stagnant hypoxia. So condition, there is a like venous obstruction level, you can show also, right? Now ischemia is the most common, of course. So in between them, the ischemia. Okay, ischemia, we can say ischemia, most common case of the stagnant hypoxia. You write the ischemia. Image most common case, most common case of stagnant hypoxia. Most common case of stagnant hypoxia, guys. Okay. Now we'll talk about the last hypoxic, the type, that is histotoxic hypoxia. Okay, and also very important, the histotoxic hypoxia, guys. Now I have to know what is histotoxic hypoxia. Histo means what? We can say cell or tissue. Okay. Histotoxic hypoxia. So just let me give an example. First of all, let's consider it's a cell, and whenever this within the cell the oxygen will come, it will do what? The oxidative phosphorylation, right? And it will do the TCA cycle, electron transport chain system, then it will produce ATP. Okay, so we can say within the cell the I'm writing is process oxidative phosphorylation, phosphorylation, of course it's a. Then we all know it within the cell, within the mitochondria. If we just consider within the mitochondria, like this thing, okay, within the mitochondrial systems, within the, there is cytochrome, you know, cytochrome. There is cytochrome may be complex. There is like things like complex, you know, in the tissue cycles, in the in the electron transport chain, you will see it, right, like this. Then the oxidative phosphorylation, cytochrome, and what happened in these cases, there will be like the, you know, there will be the poisoning, we can see what, inhibition of cytochrome. If there is inhibition, or if there is any inhibitory things on the function of the cytochrome, then what? There will be histotoxic hypoxia. Why? The oxygen will be not utilized by the tissues, so it will reduce what? It will lead ultimately hypoxia. And this inhibition of the cytochrome, is done by some poisons things. There is like the cyanide, you can say cyanide. Okay, whenever the cyanide will get combined with the cytochrome, it will not let the cytochrome to do its function. So as a result, what it will lead to the histotoxic hypoxia. Now what can you see here? See it here probably that now, for suppose there is some individual is having high BP, okay, in emergency conditions, for suppose there is high blood pressure, and in emergency condition, what we give? There is, we give the drug that is very familiar, you know, nitroprusside, right? We give the nitroprusside, and as a metabolites, we give what? In the emergency, intravenous, we can give intravenous, right, guys? And as a metabolite, you know, metabolite part, or the metabolites of the nitroprusside is here cyanide. The nitroprusside of the metabolites of the nitroprusside is the cyanide here, okay, guys? And whenever the cyanide will get combined with the what? The cytochrome, okay, there will lead to what? Cyanide poisoning. Cyanide poisoning. And for it, what can you see? The brick red color of skin and blood. The brick red color, we can see for it the brick, the symptoms, we can say brick red color of your skin and blood. We can write skin and blood, guys, here. Okay, skin and blood here we can see. Okay, now this cyanide poisoning, these things can be treated by the supplementations of the vitamin B12. And why? There is also reasons. So if you want to treat these things, this should be what this patient should be given the vitamin B12. Vitamin B12. Okay, why? There are also some reasons. We all know it, the vitamin B12, or you can say it's another name, the methacobalamin. Methacobalamin. Okay, guys. And whenever this methacobalamin will get combined with the poisoning of the cyanide, we can say CN, it will form cyanocobalamin. Cyanocobalamin. And this cyanocobalamin, it's a water soluble compound. It's a water soluble compound. And as it's water soluble compound, so it can go through it can go outside by the process of excretion. So we can say it easily excreted in urine.